Hi, I'm Natasha. I'm a kinesiology student, and today I want to discuss this article. Is hip muscle weakness a predisposing factor for patellofemoral pain in female novice runners? So in this article, it mentions that usually females are the ones with more knee pain than males. So the purpose of this study was to figure out if hip muscle weakness is a cause or if it is a consequence of patellofemoral dysfunction syndrome. Right, so in previous studies during locomotion for women, they exhibit a greater external knee valgus movement and hip internal rotation compared to the male counterpart. And it has been suggested, well, if women can control these movements or these motions, it may depend on the strength of proximal muscle groups. And I thought that was interesting. So the idea is if there is an absence of sufficient proximal strength of the femur, it could adduct or internally rotate, which causes an increase of lateral patellar contact pressure. And as a result from repetitive activities like running, that malalignment can cause female runners more vulnerable to developing patellofemoral dysfunction syndrome. So in the study, they took 77 female runners, completely new. They were sedentary before, and this was a 10-week program, 3 days of the week, with the goal to run a 5K by the end of the program. And so they were all measured with Q angles and a hand dynamometer to measure their strength. And so the result was that 16 of the 77 runners developed patellofemoral dysfunction syndrome. And so what was interesting is that between the two groups that did develop and did not, that there really wasn't any significant difference in age, height, weight, or body mass. And there just wasn't. There also weren't any significant differences in isometric strength from any of assessed hip or muscle groups in the runners who did and did not develop patellofemoral pain. And so they said that in past studies, usually association with weakness of abductors and external rotator muscles of the hip was with the presence of patellofemoral dysfunction syndrome, and it was suggested to result from an excessive femoral adduction and internal rotation, so that increases valgus vector of the knee during dynamic tasks like running. So it still isn't quite clear of what comes first, if patellofemoral dysfunction syndrome is a consequence of hip muscle weakness, or if hip muscle weakness is the cause of it. So that is still unclear. However, they still emphasize the importance of having hip strength to help with knee pain. And so I thought to show 4 different exercises. And the first one is a single leg glute bridge. So a single leg glute bridge is very much biased with glute activation and also hip. So you have to be pretty and also emphasis a lot of stability because you are using one leg. And then the second one is lateral band walking. So this one you can use a resistant bands and also engages the lateral hip and glutes. The third one is a lateral step down. So in the photo, the woman is using a pretty tall box. Normally, if you are having hip weakness or you're not that strong in the glutes, you'd probably start off with a much smaller box and making sure to hinge at the hips, so you're using a lot more glutes, and then stepping up. And then the last one is a single deadlift. The use of glutes, hamstrings, and of course stability, and making sure that your knee isn't rotating inward. So you have to be pretty stable and looking at what your knee is doing. All right, so I hope you found this interesting. Thanks for watching.